What did I do with your name? Let's make sure I'm saying your name right.
Oh, it's perfect. Eric Liu, you said it just right.
Okay, excellent. Where are you right now? Where are you calling from?
I'm calling from Nashville, Tennessee.
I love Nashville.
Yeah, it's a great town.
Do you have country music in your car all the time?
How do you know? I'm still looking for my record deal. So.
Oh, you're just there. The whole doctor thing. You're going to give that up in a little bit, right?
That's exactly right.
So, okay, my notes say that we have this tumor has we have 4 to 6 times more than we had 30 years ago.
Yeah, it's an interesting thing. Neuroendocrine tumors are, I'll call them unusual. Let's put it that way. They used to be considered rare. But over time, it's gone up a lot. And I think a lot of it has to do with actually just better recognition, a little bit better understanding of what the disease is. But the rate still keeps going up. So I don't know if there's something else happening because there are more and more patients with it than you would think.
Any suspicions? I mean, do you think it's the way we eat, the different toxins we're exposed to? What do you think it is?
I mean, certainly the environment is a huge aspect of all kinds of cancer, and luckily we've made great strides in helping to control some of the cancers in our lifestyle habits. But it seems to be there are some kind of low-lying fruit which explain it. Things like how we classify it, better means of diagnosis.
Oh, okay.
Use of colonoscopy, things like that seem to be helping a lot. And these unusual tumors seem to be, cropping up along with other kinds of cancer. They seem to be cropping up as well. But what's strange about it is that the rate of them is going up a little bit higher than the other types of cancers. While we've made good strides in reducing the kind of the treatment of other kinds of cancers, this one continues to go up. And that's what's so unusual and strange about it.
Are there any outward symptoms?
Well, that's what's so tricky about it. These neuroendocrine tumors, there are many types of them, and that's what can be so difficult and complex. And what's challenging about them, while they tend to be slow-growing tumors, they actually have a lot of different symptoms, and sometimes there are no symptoms at all. So, for example, someone may have diarrhea for a long time. Tough topic to talk about so early in the morning, but
yeah.
I think it came up once earlier. As a matter of fact.
Yeah, it did.
Everyone's finished breakfast. But you may have diarrhea for a long time. You may have stomach pain for a long time. You may have flushing for a long time. And, there are a lot of other reasons why you may have these problems, and it's very frequent for people to see their primary care doctor and say, well, maybe this is irritable bowel, or maybe this is Crohn's, or maybe this is menopause. So you can see how it's very easily misdiagnosed. And if it lingers for a long time and it's not getting any better with the usual therapies, we'd like for people to start thinking about the possibility that it could be something unusual like a neuroendocrine tumor. And you would think, well, that sounds like a pretty easy diagnosis, but it's not. It takes sometimes 5 to 7 years on average.
Oh, wow.
Diagnosis, yeah, because no one thinks that flushing is going to be caused by cancer. Or diarrhea is caused.
So will flushing be maybe diagnosed as rosacea?
Sure, that's definitely part of what we call the differential diagnosis. Rosacea is a kind of a skin issue, but when it persists, and I have had many patients who've been diagnosed with rosacea, and they've been just kind of, told to deal with it, when in fact it was caused by the hormones that come from these cancers. See, what's interesting about these tumors is that they're not just cancerous growths, which they certainly are, but they also secrete hormones, and the hormones are what can cause people to have these symptoms, which can be difficult. Some people have rashes. Some people develop problems with their blood sugars. Some people have blood clots. It's really quite amazing the variety of symptoms that people can have, and it can be very subtle. It could be as simple as wheezing, difficulty breathing, which can sometimes be diagnosed as asthma, which is difficult to control with other types of traditional medication. So that's why this is such a challenging disease, and why we're trying to get out there and tell people about it. Not that everyone's going to have it, and not that everyone should automatically go and think they have this disease.
Yeah.
But it's something to keep in mind, because if you have it, the earlier we can treat you, the better we can take care of you, the better you'll feel, and the better you'll do overall. So
you've been doing this for a while. The treatment that you're going to tell us is new compared to what was around last year or 2 years ago?
Yes. We're very excited. So in the past couple, neuroendocrine tumors have been, I would say, the stepchild disease for a long time. We haven't really had anything new. But in the past couple of years, we've had some really exciting changes in the field. as far as treatments and even diagnoses. The new thing on the block that's just coming out now is a new medication called lanreotide or somatulin. It's a hormone therapy that's recently been approved by the FDA to actually slow down the growth of the tumors. And so they did a very large study looking at our neuroendocrine tumors, and they treated lots of people, some with, some without. And they found that the people who were treated with it had slower growth of their tumors. And so far, this has been the first trial that's been recognized by the FDA to have this effect. And so we're really excited by it, and it's nice to have more tools, because when it comes to taking care of people, you want to make sure you have every tool possible so that you can help them with either their tumors or their symptoms or whatever it is they need. And so it's a really exciting time for us.
And how is it administered? And is it a first step in what might be an actual cure?
Well, I always am very cautious about saying cure, because cancer is a very complicated disease, obviously, but it is a good therapy and good treatment, and we're excited by it because it's this medication has actually been around for many years. It's been used to treat something else. It's something called acromegaly, another endocrine disease. But the company did a very, very nice international trial studying the disease, and when they found that it applied as well to our neuroendocrine tumors, they asked the FDA for permission. So this certainly is a new tool and another step towards taking better care of people.
But the first step would be to get some kind of a test to see if you had the tumors, right, before you took the medicine.
Absolutely. The first thing you always want to do is establish a good diagnosis so you understand what's going on. The thing that we always want to do is you always want to just, first of all, if you have symptoms that are lingering longer than they really should be, let's put it that way, you want to talk to your doctor about it and do some investigation. And sometimes, unfortunately, neuroendocrine tumors probably occupy about 45 minutes out of 4 years of medical school. So it's a pretty it's a pretty low priority topic. But if you have it, you have it. And so this is what we have to consider. And so you bring up the idea to your doctor. Maybe they can do a scan, they can do some blood tests, and hopefully make a diagnosis. And if it is correct, then it is something that needs to be treated. And so if you make a good diagnosis, you find the right treatment, and lanreotide, this medication, may be a part of that treatment program.
So I have a question that I don't know if I missed something or not. If you're diagnosed with the tumors, wouldn't the first step be to take the tumors out?
Yes, actually, very good thought. Very good point. The one thing you want to do is you want to make sure that you get the right treatment, and there are many different types of treatments. And so we frequently stress that a patient who has a neuroendocrine tumor see a neuroendocrine specialist, because with all the different types of therapies, you want to make sure you pick the right one. So the first thing you would want to do, if possible, is to remove the tumor. Now, the problem is that sometimes the tumors have spread by the time it's been diagnosed. Don't forget, it takes 5 to 7 years to make the diagnosis. And so if it's spread far out, sometimes surgery isn't always the first therapy you want to go towards. You may want to go for a hormone therapy, or you may want to go for a chemotherapy to get the disease under control, and then maybe surgery will be a part of it. So neuroendocrine tumors are very different from the other types of tumors that we kind of more classically think about, say, pancreas cancer or colon cancer or breast cancer. This type of disease is different, and therefore you have to kind of choose your therapy a little more differently. The confusion is very common. In fact, the most famous person to have a neuroendocrine tumor is Apple founder Steve Jobs.
Oh.
And yes, and he was, many people thought he had pancreas cancer, which is kind of the more common, what we call pancreatic adenocarcinoma. But in fact, he had a pancreatic neuroendocrine cancer. And so, anyone who's read his book knows that one of the things he does stress is, if you can, please listen to your doctor, work with your doctor if you have some disease. And that's a very good message. But you see, he lived much longer than people would have imagined if you had a normal, kind of more common pancreas cancer.
Yeah.
And, however, if he had gotten maybe a different type of therapy, maybe his course would have been different. I can't predict for sure, but it's something to consider. That's why we always want to make sure that people get a good diagnosis, they get good therapy, be it surgery, hormone, medication, and then and always work and listen to your doctor.
Doctor, we are listening to you, and I want to make sure that our listeners can look this up, including the doctors who are listening? I'm guessing the layperson and the doctor will both benefit by looking into this more. And with less than a minute left, can you give us a website?
Yes, absolutely. Well, I'm actually the chief medical advisor to a new foundation called the Healing Net Foundation. And as you had said, it's an advocacy group trying to support the spread of knowledge to patients and to doctors. And we have a very simple website called www.thehealingnet.org.
Okay.
And there's information on there. And certainly there are many websites with information. So I encourage everyone to get as much information as they possibly can. Good
information. Thehealingnet.org if you want to look into this more. Dr. Eric H. Liu, thank you so much for being on the air with us today. Serious topic, but you helped us understand it. And if I understood it, then everybody understood it. Thank you so much for being on the air with us today.
Thank you. You guys have a great day.
Thank you. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. This afternoon, warm and humid, a shower and a high 80 to 82. Cloudy and mild this evening, low 64 to 67. Warm and humid tomorrow, more clouds and sun, high 81 to 83. Tomorrow night, cloudy and warm, a couple of showers and a thunderstorm, low 68 to 70. And then Wednesday, cloudy, breezy, a shower, a thunderstorm, high 78 to 82. From the Florida Weather Center, I'm Steve Williams.
Every Mike in Mike Scottsville liked Christmas a lot. But there was one tiny problem where someone may not. While they were all enjoying their Christmas roast beast, not everyone everywhere had such a fine feast. The phone was ringing at Central Headquarters shop. Somewhere, someone's water was never ever going to stop. They plugged it with rags, cotton balls too, and even added a didgeridoo. But their efforts were thwarted, no matter their intent. The water kept coming, and coming it went. Their frantic voice told a story of woes. But the operator on the line was a professional pro. She said with a smile, "Don't worry a bit. Mike Scott Plumbing is on the job, and we have toolkits." But what about the large bill that's coming, she'd say. We don't charge extra for nights, weekends, or holidays. Mike Scott Plumbing wishes you and yours a happy, happy holiday and many, many more.
Think unique gifts are hard to find? If so, you haven't been to Downtown Jewelry and Pawn in Bellevue. Frank has something for everyone. Antiques, costume jewelry, diamonds, gold, watches, fine china, art deco pieces, and so much more. Located at 5445 Southeast 111th Street in Bellevue, behind Checkers, a trip to Frank's Downtown Jewelry and Pawn is a must. A little elf told me that the big guy shops there. You should too. And Frank does great repairs. Who would you feed if you had 50 chicken sandwiches from Chick-fil-A? WOCA and Chick-fil-A in the Paddock Mall have teamed up to reward one organization with 50 chicken sandwiches as a way of saying thanks for the great work that organization is doing in our community. And we need your help. See, there are so many great people doing great things that we need nominations. You can nominate your own organization or any organization you choose. Simply send an email to WOCA@WOCA.com. And in 350 words or less, tell us why the organization you are nominating should receive 50 free chicken sandwiches from WOCA and Chick-fil-A at the Paddock Mall. We'll review your nominations and then select one deserving organization each month. We'll announce the winner and even read the winning entry on the air. Make sure to include the contact name and phone number of the organization that you are nominating. And thanks from your friends at WOCA and Chick-fil-A in the Paddock Mall.
Hi, my name is Dr. Erica Olstein with A Better You Healthcare Acupuncture and Eastern Medicine. As primary care physicians, we use acupuncture to treat back pain, arthritis, migraines, allergies, high blood pressure, thyroid disorders, hormone imbalances, stress, and more using all natural medical therapies. We treat the source of your problems